Hello, so my name is Luis Canedes, right? I'm a trainer here in New York City, and I'm gonna start you doing classes to show how to use this little guy here, little guy now. So I started using the massage gun after I worked for some time for like stretching and release. It's the name, I don't want to say the name of the place, but I used to work for a stretching place here in New York City maybe a year ago. That's when I was introduced to this guy here. So this is a massage gun that you charge, right? So no need to, buy batteries or anything like that. You charge and lasts long time, and it's not noisy, and pretty much it kind of hammers the muscle. And a lot of people have this nowadays. A lot of people, but a lot of people don't know how to use it. So I'm gonna show a little bit how to use it. My son said, "Mom, I don't want the drilling head," but this is what I like because it goes deeper in the muscle, but you have different heads, right? You have like a little bit more flat. You have the ball here that is softer, and you have another one that I have no idea where it is. So depending the area you wanna work, you gotta go for different heads, right? So as I do muscle release for a long time, I really like this one because really goes deep on the muscle. So what you wanna do, you wanna find the muscle that is tight, and you wanna allow that hammering, right? Massage your muscle. That's what it is. Like induce it to let go. It's tight, tight, tight. You wanna induce it to let go. So I'm gonna show how to do that today. And every Thursday night I'm gonna do that. So if you know someone that has a massage gun, please recommend this class. And I'm gonna show today the TFL. You can take a look here, right? TFL and IT band. TFL is this little guy here that connects the hips and turn into the IT band, right? That's what we are gonna use today. And pretty much what happens, this guy is tight, right? Because we sit down way too many hours. We are there working, right? Sitting down, and you see this 90 degrees angle of your hips. And then your body starts adapting into that and keeping that 90 degrees angle, because we are actually not born to sit down so many hours, but we have no choice, especially nowadays, right? So then when you stand up and you need to stand up, this muscle doesn't want to let go. It stays tight here. And then that's when a bunch of improper alignments start happening in your body. So pretty much if this is tight, you're gonna arch your lower back, and it's gonna look like you have a big belly and a big butt, instead of lengthening and bringing your navel in. So now you're not locked into this angle anymore. You're at a lengthened position here. So really important to induce this muscle to let go. There are different things that happen in the body. It's like one of them is your body builds the fascia. It's a connective tissue that kind of locks the muscle into that shortened position because it doesn't want your body to spend energy to keep the muscle contracted. And so you need to break that fascia. You need to break that connective tissue. And this is going to help break the connective tissue, right? And I'm going to show different ways to do with the gun. Why the gun? You can use foam roller, lacrosse ball, a hand roller. There's a lot of different ways you can use. I like the massage gun, and I'm going to show you why. Because many times you get home and you're so tired and you just want to relax. So that's why I'm going to show you my bed, right? And I'm going to start with the right side. So if you have your massage gun, let's try to do this together. I have this head here, but you can use another head just because it's going to go deeper. So first thing you want to do, you want to kind of bring your navel in and expose that muscle. Remember the image I showed you before. So it's like the muscle, the TFL, if you have the hip bone right here, is a little bit below. A little bit below. And how you're going to know, right? You don't want to put the gun on the bone. You want to go a little bit below. Make sure your leg is relaxed. Now you can use a pillow. Let's pretend I worked so hard today, working so many gyms in New York City. I dream back, right? And then you're gonna get the gun, right? Turn it on down here. There are different levels. I like to use the first level. I don't like to use too fast. And then you go and you place right on that guy. At first you might not feel much, but you just need a little bit of blood flow to the area to start feeling that pump into the muscle. So very important that you breathe, right? Everybody breathes, but you don't shallow breathe. You take some nice belly breaths, because the breath is gonna help your body calm down and relax. It's gonna connect your body to your mind as well. So you're gonna start being aware of that muscle. So where are you? It's like if you run back here, and this is what I'm gonna talk next time. This is gonna be the side of your butt, and this guy tends to get tight too, and I'm gonna show you next Thursday. But today we are gonna be a little bit below the hip bone, right? And a little bit in the front. That's where your TFL is. I'm gonna show the image in a little bit again. I was going to do a Zoom session sharing the screen, but I wasn't sure that this was going to work very well, so I need to do some testing. So pretty much keep relaxing the leg and applying pressure on the muscle. No rush, breathe, and you're going to start feeling the tingling going down to your leg because the TFL turns into your IT band. So you really want to work here. Navel in. And this is like relaxing, right? You're home and like, oh, I'm so tired, I wanted a massage so bad. But then, you know, massages are not allowed yet, right? With the situation we are nowadays. Maybe they are, depending where you are. And I always like to say, if you have a good masseur, there is nothing better than that, of course. But how much is a session with a good masseur, right? Can you afford that all the time? Probably not. So the gun is a good investment because you can do this to yourself. And you achieve wellness, you feel good. Just do it this, you know, this little thing here, because it's going to induce your body and your mind to relax. You can do this meanwhile you're watching a movie or having a glass of wine, right? And I like this a lot because instead of sit down and eat, when I watch TV, I don't even have a TV at home. You get into these things, it kind of relaxes you, takes the anxiety away, and makes you feel good. So this is the TFL, right? So we work here a little bit, and you can hit the muscle in different angles, right? Like this, or you incline a little bit, or go through the front, right? It's that little square here on the front. That turns into your IT band. So to your IT band, you're gonna travel to the side of your leg, and I like to find the TFL like this. You drive the gun side to side, until you feel a bend, a tight bend. And if you allow the gun drive the weight over the bend, not putting pressure exactly, you don't need to put pressure, just the weight of the gun is gonna do the work. And if you breathe, you're gonna feel the tingling going down to your knee, because the IT band runs from the TFL and connects right the side of your knee. I'm gonna show that in the picture again. And then once you find the band, you keep following the line of tenderness, right? To almost on top of the knee. You don't really want to go on the joint because you have some ligaments there. You're not supposed to do on the ligaments. Don't get concerned about that. It's all about feeling, you know. You don't feel the area that you want to work. You feel like something weird. You just don't go there. You're not going to kill yourself, neither hurt yourself. You are in control. And this is the good side of using the massage gun. You feel the pain, you feel the tenderness, so that allows you to direct the gun and the massage anywhere you want. Sometimes the person is doing the massage on you, maybe the person is not very good or doesn't understand much about the human body, or is not paying much attention, depends on what it is. And you're like, oh, please go on that spot, go on that spot, and the person go to another spot in the area that you wanted to work is not being worked, right? So this is really a good thing. So right now on the bottom, I'm not on top of the knee, I'm close. And if you're not sure, you just slide the gun side to side. And now start moving your toes up and down, because tendency is push your toes away, like you're locking the muscle in a position to defend. Your body, when feel this tenderness, tends to contract and tense. You don't want to contract and tense, you want to relax. So keep moving your foot up and down. Circles with the foot, relax your lower leg, and then you're traveling all the way up to the hips again, following the nice bend. Some people say to not foam roll the IT band, or to, like, you know, not do release there. Honestly, I feel good with the release. Always when it helps with bringing blood flow to the area. You stay more aware of the tightness. It helps release the area too, so I don't see anything wrong about that. Do you want to do just this release? No. You want to work on other areas as well. But this is always a good release, because I would say 80-90% of people have tightness on the TFL that shoots down on the IT band and creates problems with your knees, especially with knee alignment. So when you have the gun, then, for example, if you go in an area that has bone, you're going to see that the gun is going to kind of jump, right? And then you just don't go there. You don't have to go there because it makes no sense releasing bone, right? You pretty much you want to focus on the muscle and put the pressure on the muscle, trapping against the bone. That's what you want. And then you work on different angles. You can work sideways. This feels so good. If you have an idea, I already feel the relaxation happening in my knee joint. It's so good. And I did have problems on my knee in the past, and pretty much because my TFL, my IT band, especially on the right side, tends to get tight, right? So this is an option. You just lay down like that and like, oh, this is so good, thank you, and you roll your eyes and you relax, right? This is one of the options. I'm gonna show from the kneeling position because we add this stretch. Now, if you want to stretch and release at the same time, you get into a stretch position. So again, if you're dropping your belly and arching the lower back, doesn't help much. You want to kind of bring your navel in and expose, right? And here, you can go from a kneeling bridge position where you try to stay upright and you try to feel the tenderness and the release happening in your knee, right? You can do right like this, engaging pelvic floor, breathing, allowing the femur to turn outward. Femur is your thigh bone, wants to turn outward because the TFL, it kind of rotates your knee inward. So you want to kind of expose, right? The TFL does this with you. Bring it in and down. So you want to kind of open up again. You can do from a kneeling position, or you can go from a stretching position. That pretty much you keep your knee down, navel in, and you go for the stretch, right? Trying to expose the area. Find the tenderness, 0 to 10, being 10 very painful, and you stay there, relaxing and feeling good. I feel a tingling all the way down to my foot, but good thing, relaxing. And then you can go over the IT band again. When my mom was visiting me here last time here, she came from Brazil and she was telling me, oh, I have this pain on my foot, and I did a bunch of muscle release with her, with the gun and with my body, like my elbow and my hand. And I fixed my mom. And she's like, oh, I have been in so many doctors. Nobody could do this to me. And I'm going to go down to the point that, very few doctors or physical therapists or doctors that are specialists on the area are going to do muscle release on you. The good ones are going to do that. And I know a few, but a lot of them, they just want to put you to rest, put ice, and then they want to recommend some kind of injection, and then afterwards some kind of surgery. And that's like last case scenario, and this is not going to fix body alignment. So once you understand what is wrong with your body, how can you correct it, you don't need all those interference, you don't need all those things, you just need to learn how to relax the muscle and adjust your body. Remember that it's getting tight here and you want to expose the guy again, right? So now I'm gonna go to the other side. I'm gonna get into the lazy positioning again. So I just came back from home. I'm so tired. Finally, Kawhi is sleeping, or sometimes I put him to play in front of me and I'm just like, now I'm gonna treat myself. So again, make sure you're exposing the muscle, right? And it's right around this area here. And then you're gonna be trying to relax. I like to just drop the gun weight on top of the muscle and let it relax there. And then you go on that area where you put your hand on your pocket. This is the TFL. So if you can, if you have the gun, right, keep working on that area. I'm going to show the muscle again. So just keep breathing and enjoying. I'm going to show here, I don't even know, I'm on Facebook and Instagram live. So this is the TFL that gets tight, right, that turns into your IT band. TFL turns into your IT band. I'm going to show another one. And you see here how easy it is to look. You see how the TFL turns the IT band and gets tight, puts all the pressure on the knee and on the hips. I'll translate afterwards. I see there is some Brazilians asking like, oh, I'm not understanding anything, right? And I have one more graphic here. Yeah. And you can see here clearly what happens? This is the TFL turning to the IT band and connects right on the side of your knee, right? And I think I have one more. This is a complex of your hip flexors. So again, TFL right on the side, turning into your IT band, connecting on the side of your knee. And many people already that I have done personal training would tell me, I always ask, do you have some kind of joint pain? Yes, I have pain on my knee. So depending on what area of the knee, right, I'm gonna know that it's TFL, IT band, or maybe inner thigh connected to the psoas or your quads. It's just the joint hurts because the muscle is tight. So the muscle turns into the tendon and the tendon attacks inside of the bone. So if the muscle is tight, it's gonna put pressure on the joint and it's gonna put your body off alignment. And I like to say this, a lot of people have this issue here. The knees collapsing, right, instead of being more aligned. And why do that happen? One of the reasons is this here, right, that is supposed to be lengthened and with nice alignment of the knees get tight and internally rotates. TFL internally rotates your femur inward. And then when you're gonna see, look how much pressure on your knee is happening and how easier it is to get into an act, like, you know, getting an injury if you're running or if you're jumping, or it's just gonna start feeling the pain there. So if you don't understand that you need to relax this to be able to open your knees again in a better alignment with your body, right? If you don't understand that, you can do a million surgeries and you're never gonna be fine. This is what I say, question Western medicine, you know? Yeah, not always, they have the best intentions, but you know, sometimes they're not being, maybe the approach is a little bit more towards making money, you know, surgeries, injections, and all of that, with all respect, because I know a lot of good physical therapists and very good masseuses. Talking here about Geraldine Burgos, Irene Lee, you know, I know some very good people there that do great work towards realigning the body. So now let's drop the belly, right? This is tight, navel in from a kneeling position. You want to try to get on that guy again with the massage gun. So it's pretty much hammering. You want to allow the gun to hammer the muscle. Allow it to like, try to fully relax the muscle there. Navel in, not dropping your body weight on the knees, you're upright. Femur turning outward, femur is your thigh bone, right? To open this area a little bit more. And then if you want, you can go to a stretch position. See how much I'm exposing here now, navel in. Go to a stretch position and allow the gun to go deeper on that muscle and hammer the muscle. Keep hammering, and relax. If you really relax your leg, your foot, you're gonna feel that tingling running all the way down. And this can reflect, as I said, in pain at your foot, pain at your ankle, pain in the base of your foot, because these muscles are all connected. They're not isolated. That's why when you're working out and you want to work like gluteus or, I don't know, legs, calves, you have to avoid being in a position that is not functional. Functional means you're not in a position that you're actually gonna need your body to work on. And a good example is those machines that you bend the knee and extend, right? Knee extension machine. Your foot is floating on the air, you're sitting down, that's awful for you, and then you're strengthening the leg on that sitting down position, that's a killer. You should not do that. You should do only with a trainer that knows what's doing, right? Knows that you're not tight on that area. And even though you should kind of avoid that, I don't recommend at all. You want to strengthen your legs and your lower body. Do squats, do deadlifts, things that your feet are planted on the floor, you feel balanced, you're engaging your core, and you're not sitting down, right? We sit down way too many hours. Why you're gonna sit down again to work out? Doesn't make any sense. But anyway, and let's go down to the IT band, traveling side to side. I think I can be polemic with things connected to the body because it's my area, right? I can't be polemic with other areas, but I guess I can be polemic with this. So all around down to the IT band, and this feels so good. I feel the relaxation happening in my knee already. You know, that pressure is, the knee is tight, the hips is tight, and now you just feel the nice release. You can go work from the stretched position. Good. And I'm gonna show now from a strengthening position, because when you release, you wanna release Then you want to stretch, and then you want to adjust. And pretty much adjust is trying to strengthen your body from ideal position. So I'm gonna show really fast my favorite. My favorite is a must do. It's a must do exercise. So most of us are on this position, sitting down, right? Imagine if I'm sitting down. Your hips are 90 degrees, your knees are 90 degrees. So now what you need to do, you need to open this guy again. So navel in, squeeze your butt, and lengthen here. You're opening here. Make sure your butt is tight. If you don't feel your butt, bring your heels closer to you. Nice arch, right? This is functional because your feet are straight. And you can do the release from this position, because you can be in this position and all you're using is your TFL in your thighs to stay upright. You kind of want to give work to your butt now and use your butt to stretch the front of the hip. So you can go for a bridge and do some muscle activation towards the butt. Imagine your femur is turning outward. And again, you go on the TFL there and you work towards the IT band, because the gun is going to make you relax that muscle. It's going to start hammering the muscle. The muscle can't stay contracted like that. It has to let go. So if you're doing one side first, you're going to feel how much more butt activation you're going to get on one side. And then if you do on the other side, you're going to see how much more butt activation you're going to get on the other side. So this is all different options that you can do meanwhile using the gun. And then you can relax your butt, squeeze your butt up, trying to give work to the butt and not to the TFL. Again, and if you're here and you're dropping the belly, this doesn't help much because you're arching your lower back, you have a big belly, big butt. You gotta bring your navel in, push your knees towards the toes, and have a nice foot positioning, right? Not tilting the foot side to side. You wanna have that foot strong with the arch against the floor or against the bed. And then you can travel towards the IT band as well. So pretty much this is it. This is the release with the massage gun. So if you have a massage gun, try to keep up with me. Try to follow through the classes, because I'm going to teach you how to release some nice muscles and that tend to get very tight. And you know, you're going to be free from knee pain, lower back pain, and your body's going to work better, and you're going to be a better athlete, and you're going to be able to work out. Nothing holding you back. Pretty much that's it. Let me see if there is any messages here. Oh, okay, nice to see. Haha, I miss so many people. I haven't seen people so much. Let me see here. Elizabeth, não existe, não estou entendendo nada. Yeah, it's complicated because it's in English. But anyway, this is it. I hope if you have a massage gun, you bring that to your routine and use the massage gun as often as you can. And I'll be back next Thursday teaching you how to release gluteus medius and gluteus minimus. That helps a lot with lower back pain and knee pain as well. And better posture, better digestion, and less stress. I guess all of us want less stress nowadays, right? So this is it. Enjoy your day.